This is our program evaluation for research methods. Our group consists of Carly Mossino, Anna Pucchia, Reed Brown, and Annie Dorr. Our professor is Rebecca Ruland. For our program evaluation, we are choosing to focus on the children's program at Willow Domestic Violence Shelter. We hope you enjoy. Willow Domestic Violence Center has provided services for the greater Rochester community for nearly 40 years. Mission: prevent domestic violence and ensure every survivor has access to the services and supports needed along the journey to a safe and empowered life. A program evaluation, needs assessment, is used to learn what resources are needed, which populations are most in need, and how we can improve supports. The community at Willow includes all adults and children that have survived domestic violence, and almost half are children. By making sure children have access to the appropriate resources and support, long-term effects of domestic violence can diminish or be less severe. For example, long-term depression, anxiety and PTSD. The trauma that many children have gone through can affect their access and experience of services, their ability to cope and their strength to feel safe physically and emotionally. A needs assessment for the children at Willow will identify current and future triggers, reduce re-traumatization and enhance the quality of interaction with staff and services that can be provided to them. The needs assessment can be more inclusive and individualized for each child. Each domestic violence case is not the same, so why would their treatment plan be identical? The needs assessment would determine the amount DV they've been exposed to and help verify what supports they have during the treatment process. Needs assessment would determine counseling and therapy option, triggers, build better rapport between staff and children. A needs assessment at Willow would gather information about the child, reviewing their current situation and planning ahead to better their future treatment. Early childhood assessment, ND. It would identify social emotional difficulties, additional support that is needed, meeting the child where they are and creating an individualized plan to better their development to avoid potential long-term effects. We are proposing a needs assessment as our type of evaluation proposed. A needs assessment is a decision-aiding tool used for resource allocation, program planning, and program development based on the assumption that planned programming can alleviate distress and aid growth. A community needs assessment identifies the strengths and resources available in the community to meet the needs of children, youth and families. It is the framework for developing and identifying services and solutions and building communities that support and nurture children. A needs assessment can range from simple to complex. There is no one standardized approach to conduct a needs assessment. However, all formal needs assessments weigh the accumulated useful data and the evaluator makes a judgment about the severity of need to inform setting priorities and program establishment. A needs assessment is used to answer the following questions. Is a new program needed? Is an old program still required? Is there a need at all for this program? The reason that a needs assessment is appropriate is because in order to use this evaluation, there must be a social problem that is potentially addressable through interventions and/or programming. Domestic violence is a social problem that is visible to some proportion of the population. There are many different types of needs that need to be addressed. Social needs can be thought of as a basic requirement necessary to sustain the human condition. Perceived need, felt need, the perspective of a particular person/group about a problem at a given time. Normative need, condition or situation defined by an expert. Relative need, need of one group is weighed against another. Express need, a demand for service. Things to consider. Evaluators need to be sensitive to different perceptions about need. When trying to determine what a client population needs, try to involve clients in the process first. Currently at Willow there is only a one-on-one intake with the adult, or victim of the abuse. Therapeutic services are further only offered to the adult. Children are not involved in this process. I think it would be important to do one-on-one intakes with the children brought into Willow, have to be 3 years of age or older, as children account for almost half of the program here. We know that witnessing domestic violence as a child can be quite damaging to long-term mental health. Thus, by utilizing the ACES assessment, we can measure if the child indeed witnessed domestic violence in the home, or other ACES for that matter, that can affect their mental health requiring intervention. Further, during intake, we can ask the child to draw a photograph of how they represent their family, moreover utilizing the research-designed photo voice. By asking the child to draw a representative photo of their family, we can attempt to understand the family dynamic or home environment. Moreover, photo voice is used to observe and interpret the world and experiences through photographs, or in this case drawings. In other words, photo voice allows the participants to construct their social reality. From here, we can determine if the child needs continued therapeutic services at Willow to build resilience in the face of trauma they may have endured or witnessed. ACES are connected to poor mental and physical long-term health, and as domestic violence is an ACE, we must measure their trauma using this assessment tool to determine if further intervention to build resilience and counteract the negative effects of an ACE should take place. Further, by utilizing photo voice as a tool, we ethically figure out how a child views their living situation and family dynamic from their own point of view, constructing their own social reality. The ACEs assessment is a 10-question assessment developed by the CDC to identify the ACEs a child has experienced from birth to 18 years old. The ACEs assessment assesses for abuse, neglect, and family dysfunction. Individuals who have experienced one or more ACEs are more likely to participate in risky healthy behaviors, develop a chronic disease, and die earlier. Thus, as a person's ACE score increases, so does the risk of disease, social, and emotional problems. With an ACE score of 4 or more, the negative outcomes then become that more damaging. It is increasingly important for social workers to continuously assess children who they believe have been abused in order to counteract these negative health consequences. An example of an ACES question would be: was your mother or stepmother A. often or very often pushed, grabbed, slapped or had something thrown at her? Or B. sometimes, often, or very often kicked, bitten, hit with a fist, or hit with something hard? Or C. ever repeatedly hit over at least a few minutes or threatened with a gun or knife? The steps to doing an ACEs assessment are as follows. Intake with a child 3 years or older, in the form of a relaxed interview with a social worker. There are toys to play with for the child to feel exceedingly comfortable. Ask the child to draw a photograph of their family. Children can utilize any of the arts and crafts available in the room. Tell the child that we have 10 easy yes or no questions for them to answer. Facilitate the ACES assessment, read it to them and record their answer. Continue to talk to the child. How are they feeling? Make them feel protected and safe. If the child scores with at least one ACE, further therapeutic services will be required for the child during their time at Willow. If the child draws a picture that may represent chaos or dysfunction, further therapeutic services for the child will be required during their time at Willow. Data collection steps. Once Willow implements the need of therapeutically treating children while at Willow who have experienced an ACE, we can compare their long-term mental health to those who have not been treated therapeutically and have experienced an ACE. If the children who have been treated therapeutically fare better long-term, we then know the need for increased therapeutic child care at Willow was necessary. Credibility, by conducting intake assessments with children, and by measuring trauma endured in the child via the ACES assessment and asking the child to draw a representative photo of their family dynamic, we as social workers can easily determine the need for further therapeutic services. Thus, by utilizing both measurement tools, we can cater towards all ages and further guarantee we are getting credible and trustworthy information from a young and vulnerable population such as a child. Trauma in research and human rights. Classifying their trauma, acute or complex. When a human service program takes the steps to become trauma-informed, every part of its organization, management, and service delivery system is assessed and potentially modified to include a basic understanding of how trauma affects the life of an individual seeking services. Trauma-informed organizations, programs and services are based on an understanding of the vulnerabilities or triggers of trauma survivors that traditional service delivery approaches may exacerbate, so that these services and programs can be more supportive and avoid re-traumatization. Trauma-informed principles: safety, trust, choice, collaboration, empowerment. Human rights are rights inherent to all human beings, whatever our nationality, place of residence, sex, national or ethnic origin, color, religion, language, or any other status. We are all equally entitled to our human rights without discrimination. These rights are all interrelated, interdependent, and indivisible. United Nations, 2017, Para 1. Domestic violence is a type of trauma that affects many of the individuals involved, including the children who may be in the abusive situation. By using trauma-informed care frameworks at Willow is essential towards providing recovery and safety to allow them to heal. Limitations. Clients may not want to convey personal or private needs. Potential for biased, unrepresented samples. Potential for low response rates. Strongly influenced by expertise and knowledge of the expert.